Hello and welcome. My name is Marty Hatley. I'm a patient safety advocate and a principal at H2PI, the Healthcare Patient Partnership Institute. Joining me today is Caroline DeLongchamps from the Medical University of South Carolina. Welcome, Caroline. Thanks so much for joining us today. Will you tell us what your title is and what you do at the Medical University of South Carolina?
I'm Caroline DeLongchamps. I am the manager of Patient and Family Center Care at the Medical University of South Carolina Health System.
Thanks, Caroline. What we'd like to do today is explore your thoughts on the importance of leadership support in establishing a patient and family advisory council.
I would say leadership is not just important, I think it's critical, but I would also say don't let it stop you from getting started, but always working towards having it. I think I used to imagine when I first started in this work that I had to have the CEO. The CEO had to be a part of the Patient and Family Advisory Council. And it's a noble goal, to be sure, but it shouldn't stop us from doing the good work that we do. And what's really important is not a title that is present at your table. What's really important is finding those champions in your organization. It may be a director, it may be administrator, and it may be a frontline staff member. And all of those people are crucial to helping elevate the role and the work that the PFACQS is doing. I would keep the focus more on finding the right humans to be at the table that are passionate about this work and can help elevate the work that they do in the organization.
Thank you. I mean, you've really underscored the importance of having that champion and having that person who has invested their emotional energy in the success of your PFAC. Once you engage those people, though, can you say a little bit about meeting their expectations? To get them engaged, you must have to explain to them what you're doing or what you want to do to succeed. What do they want to hear?
Once you've invited them and asked them to participate in the group, what is their understanding of what patient and family center care is? And that's one of the things that I'm learning now, that in the years that I've been doing this, I've done a lot of prep work to educate and orient our patient and family advisors, but I have not done an equal job of that with our care team members. It's sort of like, will you come be on our patient and family advisory council? And oh yay, I'm so excited. And then I just expect them to show up and know how to engage with patients and families. And so recently, in the last few months, with the help of one of my patient and family advisors, we reworked the advisor orientation. So now it's PFACQS orientation instead of just geared toward advisors. And so my job is really to help dispel the idea of us versus them, which is we are creating the agenda. My job is putting the people in the room, then it's our job as a group to create one team. So we're bringing the perspectives of our patients and families, we're bringing the perspectives of our care team members, but what is it that we can do together and accomplish together in this room? And I think that's the magic of what these partnerships are all about.
Thank you. That's an interesting perspective. So what I heard is that you're preparing more now, not just to orient the advisors, but to orient both the staff members of your PFAC, but also leadership. Do you have any advice about how to prepare? How did you do that? What research did you do? What messaging did you develop?
There's no magic bullet and there's no one right way to do this. I know when I first started on this journey, I shamelessly stole from other organizations to where now very little left from what I've stolen and it's more ours. I think that the expectation of being able to sit down with each of your care team members or staff prior to them serving on the council is not realistic, especially now. What I'm learning in our organization is people are really burned out. So what we're trying to do in our PFAC meetings now is really talk about what we can do to support them. So it's a very different model than what we're used to.
Well, that is great advice, Caroline. Let me see if I've got it right. So what I heard is that you do develop a message to deliver that changes over time. You mentioned saving time, saving money, making their lives easier, and that it changes from organization to organization. You've got to kind of develop it and evolve with it as it goes along. Do I have that about right?
Yeah, and I think giving them tools to work with. In the wake of George Floyd's death, we were doing a lot of work in our organization around racial disparities, racial injustice in healthcare. And so I invited one of our patient and family advisors to share her story and put it on video. But I asked her to give us really tangible things that we could do. I said, think about the young nurse. What does she do with what's happening in the world right now? How does she apply that in her relationship with you in the hospital? And she gave some really great examples. And she also said, look, we can ignore what's going on outside the walls of our hospital all day long. But eventually those events are going to make their way through our doors, and they're going to impact the way you deliver care and the way I perceive my care to be delivered. And that's just one little thing that we could do to offer and to say to our care team members, this is for you. You can share it with your teams. But again, it's just to help us be better.
Thank you for underscoring the importance of sharing stories, sharing real experiences, because you're right. I mean, I see that really keeps it real, and especially when it's tied to events that are happening in your community or that could happen in your community. I think it's really important. Thank you, Carolyn. This has been great. I've really enjoyed catching up with you today.
So I've enjoyed catching up with you too.